This right shoulder in the lateral decubus position has anterior instability and a non-engaging Hill-Sachs lesion is shown. As viewed through the anterior superior portal, the shaver can be brought in to debride the Hill-Sachs lesion and stimulate it for subsequent remplissage. Next, the drill bit is brought in and drilled a hole into this hard, compacted Hill-Sachs bone, followed by a tap and then an anchor. The authors prefer 1 or 2 rotator cuff type anchors that are double loaded. One can see an anchor that we typically use here. Next, following placement of this anchor, the cannula is backed up just posterior to the infraspinatus fascia. And through this cannula, a disposable retrograde retriever is passed in a relatively lateral position through both the infraspinatus fascia and posterior capsule as shown. Suture limbs are then sequentially removed. First, the most lateral of the 2 suture limbs, and then one slightly more medial, but in a relatively lateral position still within the posterior capsule. After these inferior suture limbs have been retrieved, the more proximal or superior limbs can then be retrieved in a similar fashion. After all 4 of the suture limbs have been retrieved, then the Bankart repair is carried out. Note the significant amount of space that's available for us to retrieve sutures in anterior instability because of the anterior translation that patients have in instability anteriorly. Also, when we pull on these sutures, we can see the posterior capsule advance into the Hill-Sachs defect. Next, we've now completed our Bankart repair. The head is pushed posteriorly due to obligate posterior humeral head translation, and note the very limited amount of space that would now be available to do a remplissage. After the Bankart is completed, then the remplissage sutures are tied as a last step. In this same patient, again in the lateral decubitus position, the cannula is brought in and a very firm stop is noted at the infraspinatus fascia. These suture limbs are then sequentially removed, passed through the cannula. The cannula is then advanced back to this infraspinatus fascia point, and an assistant holds the cannula in place so that the cannula neither advances anteriorly or retracts posteriorly. A standard sliding knot is then placed, and 3 half hitches are then placed. These suture limbs are then cut as per normal protocol, and then this process is repeated for the second set of suture limbs. The cannula is removed, the sutures are retrieved through the cannula, and the cannula is then advanced to the infraspinatus fascia where that secure stop is felt. The cannula is then held in firm position, and the second set of suture limbs are then tied using a standard sliding knot. Again, half hitches are placed behind the sliding knot for knot security. And that completes the arthroscopic Bankart with Hill-Sachs remplissage using this blind tying technique.